Many people believe diabetes becomes easier to manage with age because routines are stable and eating habits are predictable, but medically, the opposite is often true. After 60, the body becomes less forgiving. Blood sugar spikes last longer, insulin works slower, inflammation rises silently, and organs that once compensated easily, like the pancreas, liver, kidneys, and muscles, begin to struggle under repeated stress. What makes this dangerous is that the damage does not happen dramatically. It happens quietly, meal after meal, year after year. In my clinical experience, most seniors with worsening diabetes are not failing because of a lack of medication, but because a few everyday foods are constantly pushing their blood sugar, blood vessels, and nerves beyond what the aging body can safely handle. Understanding which foods accelerate damage is just as important as knowing which foods are healthy, because avoidance is often the most powerful medicine after 60. As we age, muscle mass naturally declines, digestion slows, insulin sensitivity reduces, and the ability to buffer glucose fluctuations weakens. This means that foods which cause rapid rises in blood sugar become far more harmful in older adults than in younger people. Research published in major nutrition and endocrinology journals consistently shows that older adults experience higher post-meal glucose peaks and slower glucose clearance, even when eating the same foods as younger individuals. This prolonged exposure to high glucose increases oxidative stress, damages blood vessel lining, and accelerates diabetic complications such as nerve damage, kidney disease, vision loss, and cardiovascular disease. The foods I am about to explain are not occasional indulgences. They are foods that, when eaten regularly after 60, quietly worsen diabetes control and speed up aging from the inside. The first food seniors with diabetes should strictly avoid is sugary beverages, including soft drinks, packaged fruit juices, sweetened teas, flavored milk drinks, energy drinks, and even homemade drinks with added sugar or jaggery. From a medical perspective, liquid sugar is one of the most dangerous forms of sugar for the aging body. Unlike solid foods, sugary drinks require almost no digestion. The sugar enters the bloodstream rapidly, causing an immediate spike in blood glucose. In younger people, insulin may respond quickly enough to manage this surge. In seniors, insulin response is slower and weaker, leading to prolonged hyperglycemia. Multiple studies published in diabetes and nutrition journals have shown that regular consumption of sugar-sweetened beverages significantly worsens insulin resistance and increases the risk of diabetes complications, especially in older adults. What makes sugary drinks particularly harmful is that they bypass natural appetite control. Because liquids do not create fullness, seniors often consume large amounts of sugar without realizing it. A single glass of packaged fruit juice can contain as much sugar as several teaspoons of table sugar, but without the fiber that slows absorption. Research has shown that even 100% fruit juices, when consumed regularly, increase glycemic load and worsen blood sugar variability in people with diabetes. For seniors, this repeated glucose variability is dangerous. It damages the endothelial lining of blood vessels, contributing to poor circulation, erectile dysfunction in men, cognitive decline, and kidney stress. Over time, sugary drinks accelerate inflammation and glycation, where sugar binds to proteins and damages tissues, one of the core mechanisms behind diabetic aging. The second food that seniors with diabetes should avoid is refined carbohydrates, especially white rice, white bread, refined flour products, bakery items, biscuits, and many processed cereals. These foods are often culturally accepted as light or easy to digest, but metabolically, they behave almost like pure sugar. Refined carbohydrates lack fiber, protein, and fat, the components that slow glucose absorption. Once eaten, they are rapidly broken down into glucose, causing sharp post-meal blood sugar spikes. Large population studies, particularly in Asian countries, have shown strong associations between high white rice consumption and poor diabetes control, increased insulin resistance, and higher rates of diabetes complications. After 60, muscles, the primary site where glucose is stored and used, decline significantly. When muscle mass is low, glucose has fewer places to go, so it remains in the bloodstream longer. This makes refined carbohydrates especially harmful for seniors. Each meal becomes a glucose overload event. Repeated daily spikes lead to chronic inflammation, worsen pancreatic stress, and accelerate beta cell exhaustion. Clinically, I often see seniors whose fasting sugar looks acceptable, but whose post-meal sugars remain dangerously high due to refined carbohydrate intake. Over time, this pattern contributes to nerve pain, foot numbness, vision problems, and increased risk of heart attacks and strokes. The third category seniors with diabetes should avoid is deep-fried foods, including fried snacks, street foods, fast foods, and any item cooked repeatedly in oil. The danger of fried foods goes beyond calories. High-temperature frying produces oxidized fats and advanced glycation end products, both of which are highly inflammatory. These compounds worsen insulin resistance at the cellular level, meaning insulin becomes less effective even if the body produces enough of it. Scientific research in metabolic health shows that diets high in fried foods are associated with increased markers of inflammation, poor glycemic control, and higher cardiovascular risk. For seniors, fried foods create a double burden. First, they increase body fat, particularly visceral fat, which releases inflammatory hormones that worsen diabetes. Second, they damage blood vessels, making circulation poorer. Diabetes already narrows and stiffens blood vessels. Fried foods accelerate this process. This is why seniors with diabetes who regularly consume fried foods often develop complications earlier and more severely. Poor circulation leads to slow wound healing, increased infection risk, and higher chances of amputations in severe cases. From a medical standpoint, reducing fried food intake is one of the most effective ways to slow diabetes progression after 60. The fourth food group seniors with diabetes should limit or avoid is full-fat dairy and processed animal fats, including full cream milk, butter, cream, cheese, fatty cuts of red meat, sausages, and processed meats. While fat itself is not the enemy, saturated fat in excess worsens insulin resistance and negatively affects cholesterol balance. Research published in cardiovascular and diabetes journals has shown that high intake of saturated fats is associated with increased insulin resistance and higher LDL cholesterol, both of which increase the risk of heart disease, the leading cause of death in people with diabetes. After 60, the liver becomes less efficient at processing fats. Excess saturated fat leads to fat accumulation in the liver, worsening insulin resistance and contributing to fatty liver disease, which further destabilizes blood sugar control. Processed meats also contain sodium, preservatives, and nitrates that increase inflammation and blood pressure, dangerous combinations for seniors with diabetes. Clinically, many older adults believe protein from meat is always beneficial, but excess fatty and processed meats often worsen sugar control and cardiovascular risk rather than improve strength. The fifth and often most underestimated food category seniors with diabetes should avoid is packaged snacks, sweets, and hidden sugar foods, including biscuits, cakes, pastries, sweetened cereals, flavored yogurts, energy bars, and many so-called diabetic-friendly products. These foods often combine refined flour, added sugars, and unhealthy fats, creating a triple metabolic burden. Even small portions can cause significant glucose spikes. Studies on dietary patterns show that frequent consumption of ultra-processed foods is strongly associated with poor diabetes outcomes, increased inflammation, and accelerated aging. What makes these foods dangerous is that they appear harmless in small quantities. Seniors may consume them daily without realizing the cumulative impact. Over time, these foods increase insulin demand, worsen insulin resistance, and contribute to weight gain and metabolic stress. Many packaged foods also disrupt gut health, which plays a critical role in glucose regulation and inflammation control. Emerging research highlights the link between gut microbiome imbalance and worsening diabetes, especially in older adults. It is important to understand that diabetes after 60 is not just about numbers on a glucose meter. It is about protecting organs that are already vulnerable due to age. High blood sugar damages nerves, leading to numbness and pain. It damages kidneys, leading to protein loss and eventual failure. It damages eyes, leading to vision loss. And it damages blood vessels, increasing the risk of heart attacks and strokes. The foods discussed above accelerate all of these processes by increasing glucose variability, inflammation, and oxidative stress. From a medical perspective, avoiding these foods does not mean deprivation. It means choosing stability over stimulation. Seniors who replace sugary drinks with water, refined carbs with whole grains, fried foods with steamed or baked options, fatty meats with lean proteins, and packaged snacks with natural foods often experience more stable blood sugars, better energy, improved digestion, and fewer complications. These changes do not work overnight, but over months and years, they significantly slow disease progression. In conclusion, aging with diabetes does not mean inevitable decline. It means the margin for error becomes smaller. Food choices that once seemed harmless can now cause lasting damage. By understanding which foods accelerate harm and consciously avoiding them, seniors can protect their blood sugar control, preserve organ function, and maintain independence and quality of life. Medicine can manage diabetes, but daily food choices determine how well the body ages with it. After 60, avoiding the wrong foods is one of the most powerful treatments available, quiet, consistent, and profoundly effective.